So yes, these were 5 muscles: tensor villi palatini, levator villi palatini, musculus uvulae, latoglossus, latopharyngeus. We tried to remember them. Then there was motor nerve supply of palate, sensory, and then sensory was by greater palatine nerve, lesser palatine nerve, mesopalatine nerve, and glossopharyngeal also supplies part of a region of soft palate. And then there was motor by pharyngeal plexus, except there was a vagabond tensor villi palatini, T for tensor and T for trigeminal nerve. They were the trigeminal nerve was supplying the tensor villi palatini. Okay, let's start. Blood supply of palate. Okay, so we're talking about palate. Okay, we are still talking about palate. Okay, and then there is I'm sure there should be name of palate. Okay, so same as that, we had sensory supply by maxillary nerve, arterial supply by maxillary artery. Thank you. Because why maxilla? Because the palate is on the roof and maxilla is the closest. Okay, so artery, for the artery we are talking about palatine, greater palatine, then there should be lesser palatine and sphenopalatine. Okay, how to remember that? There is palatine and it supplies palate. So there is palatine, how to take you down. Okay, so there is palate and we have palatine. This is easy to remember. So greater palatine, lesser palatine, and sphenopalatine. So we also had a greater palatine nerve, lesser palatine nerve. So we also have artery, greater palatine artery, which all its branches supply a lot of arteries, and then lesser palatine to a small area of lesser area of palatine. Okay, then there is also one sphenopalatine. And then there are, other than maxillary artery, there is ascending palatine, because the roof is ascending in the oral cavity, it's upside, the palate is ascending on the upside, so there should be artery. This is how we remember ascending palatine. And there is pharyngeal, we going the if here is pharynx, right? If here is pharynx and here is palatine and we need to ascend towards the palate, then there is also ascending pharyngeal. That's how we remember. Okay, so from maxillary artery, there is palatine, 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 greater palatine, lesser palatine, and sphenopalatine. Then there is ascending palatine and ascending pharyngeal. These are the 5 arteries. I hope we can remember if we revise enough times. Okay, so again here, there is greater palatine artery to hard palate, lesser palatine artery towards soft palate, and ascending palatine artery also towards a soft palate. And then there was ascending pharyngeal and sphenopalatine. In the previous slide, we know. Okay, so venous drainage of the palate is to the pterygoid plexus. Oh, so there was another, we have, so there was a P something, right? Oh, pharyngeal plexus. There was a motor. So this was plexus of the motor's supply. Nerve supply of the palate, the motor supply, pharyngeal plexus, and vein, pterygoid plexus. Okay, P. Okay, we can remember. Oh, P is also for palate. I see where this is coming from. So lymph is mostly drained to the superior deep cervical nodes. Why superior? Because palate is superior on the upper side. Okay, that's how we remember. Okay, we understand greater palatine artery, lesser palatine artery, greater to the hard palate, lesser to the soft palate, and then there is sphenopalatine. Everything has palatine, and then ascending palatine. We are ascending upward, and pharyngeal palatine has to ascend. Pharynx has to ascend to reach palatine, ascending pharyngeal artery. And then when we goes to vein, there is same P, right? Pterygoid plexus, and then lymph are to the superior cervical nodes or superior deep cervical nodes. So there are inferior and superior. Okay, now we remember. So let's see what is the pterygoid plexus of vein. So this is plexus. Okay, so when there are a lot of veins forming a network like this is known as plexus. There are many plexuses in our body. One of them is found here, pterygoid plexus. It also takes blood or drains blood, or the blood is drained from the palate into this pterygoid plexus. This is the importance here. You no need to remember more than this. And thus this plexus is going into maxillary vein, same as maxillary artery, and going into external jugular. Okay, pterygoid plexus, maxillary vein, external jugular. Easy to remember, no problem. I hope if we revise enough times, we can. So this is another relationship of the blood supply around palate. So this is pterygoid plexus draining into maxillary vein, pterygoid venous plexus. Here, pterygoid venous plexus. I should change the color. Okay, this is more fun. Pterygoid venous plexus. Here, draining into maxillary vein. Above them is also taking from cavernous venous sinus and inferior ophthalmic vein and facial vein. Everything is connected, but this facial vein is going internal jugular. This pterygoid plexus, and then from here it also connect to this part, but majority it comes from the maxillary vein into the external jugular vein. Okay. Why we need two pictures? Mostly we have two pictures. Why, sir? Why you need to add more pictures? Because I want you to revise. I want you to remember, and not me here. You get used to it. So just you have less time. You need less time outside the class. Okay, sir, makes sense. So clinical notes of palate. So now we go for some of the deformities of palate. We know very famous cleft palate. Yes, we know you. Okay, how many types? Unilateral, bilateral, median. Okay, let's see how it looks like. So if this is normal palate, you're disturbing our view. Please, can you go here? Kind of. Okay. So there is normal palate, then there is cleft palate. Okay, cleft palate, and then there is bilateral. This is unilateral. This is bilateral, and if there is median one, then there is median cleft palate. Okay, so now, but we also have some other things here. If we see, this is also a cleft palate here. This is also a cleft palate, but it's not complete. And then there is unilateral cleft and lip palate. Cleft in the lip and palate. Yeah, unilateral. And this is also, this is the lip, and this is the palate. So it's crossing all. So sorry, this is the palate inside, and this out of the lip, and this going bilaterally. So bilateral cleft lip and with full palate. Okay, now we know cleft palate is something unilateral, bilateral, and median. Yeah, and now we go to the second clinical pathology, common pathology, which is paralysis of the soft palate. Oh, soft palate is paralyzed. Why it can paralyze? Can anyone answer why it can be paralyzed? Why something can be paralyzed? Because it has bone or muscle? Because it has muscle, so muscle can paralyze. Yeah. So paralysis of soft palate. The pharyngeal isthmus cannot be closed during swallowing and speech. So if, let's ask someone a question. So if pharyngeal plexus, during swallowing, pharyngeal isthmus or oropharyngeal isthmus cannot be closed during swallowing, what happens when it cannot be closed during swallowing? What can happen? We have Arnab Saqib. Oh, sorry. Zarnab Saqib. Or Zarnab Saqib. I'm sorry if I pronounce your name. Can you correct your name? Can you tell me your name, please?
Yes, sir. It's
Zarnab Saqib. Okay, Zarnab Saqib, roll number 024. Can you tell us if during swallowing it's not closed, what can happen? Where is the windpipe and where is the food pipe? What is anterior, windpipe or food pipe?
Sorry, basically an aspiration can happen when you cannot.
Aspiration pneumonia. You're talking about aspiration pneumonia? Okay,
Yes.
you are forward than us. Okay, congratulations. But good. And so what is anteriorly present in our body? Anatomically, our food pipe esophagus or our windpipe, trachea? Which one is in the front and anterior to our body?
Sorry,
Do you
sir.
understand? Do you understand my question? Among the two pipes, the food pipe known as esophagus and windpipe known as trachea, which one is anterior to the other? Which one is anteriorly present in our body? Is esophagus anterior to trachea or trachea anterior to esophagus?
Trachea.
Trachea. How you guessed it? So how to remember it without Google is because when we perform tracheostomy, okay, thank you for your answer. So when we perform tracheostomy, it should first enter the trachea. That's how remember. If we puncture the, you know what is tracheostomy, right? Tracheostomy. Okay, so when someone is not taking respiration normally through the nose and the whole thing, and if there is, suppose, let's just say hypersensitive reaction, allergy, or how to say, goming allergy, and then there is narrowing or closure of windpipe, so then we have to perform tracheostomy. And if we enter from outside, from around the neck area anteriorly, then if the food pipe is in front, oh, then we have punctured the food pipe. It must be trachea. That's how you remember the trachea is in front of the food pipe, esophagus. Okay, the paralysis. So if we cannot swallow, if there is paralysis and pharyngismus cannot stop, then the aspiration pneumonia can happen. How aspiration pneumonia can happen? Okay, there are two ways. First, if we eat food, food can enter into the windpipe. Aspiration pneumonia is mostly seen in the bedridden patients when they have post-surgery, post-operative period. They are all the time on the bed, having less movements, and then trachea anterior. Okay, and then the regurgitation from the mouth or acid or anything will enter into the trachea and then finally into lungs, causing aspiration pneumonia because the aspirate has entered into the lungs, causing pneumonia. And during speech, if the paralysis of soft palate is or speech, because palate, especially soft palate, is movable, is a muscular fold, it helps in the movement and making and speech and making basically different kinds of sounds. It helps in the modification of sound and speech. So if it's paralyzed, so we cannot speak properly, or the sentences will not be clear. Okay, so this is again cleft palate. So this is normal palate all the way to the, this is the frontal facial view, anterior view, and this is one of the transverse view. Then you see unilateral cleft, lip and palate, because lip is also and palate is also involved. Here is another view, and there is also another transverse view, horizontal view. Then there is bilateral cleft, lip and palate. Both lip and palate are involved, and this is bilateral. And if someone is asking this baby and this baby are same, I really don't know. But as we know, this baby also had a unilateral cleft lip and palate towards the left side of the patient. She went to surgery. Before surgery, it looked like this, and after surgery, she was smiling. And after several years of smiling, oh, sorry, surgery, I was just kidding. After several years of smiling, she looked better. So the surgery can help us to solve this cleft palate issue. Okay, so there is a paralysis of soft palate. There's also a case report. I will later send in the group with this newer slide. I will share in the group. And you can see the case report. And what is a case report is basically whenever medical team of doctors in a hospital, they see different new case, they can write a report on that new case or a different finding, a new finding, in their own words, in their own, how they have experienced firsthand, that they can write in their own words, in their own story, to let people know that the case of, let's just say, soft palate paralysis can also present this way, can also present that way. So we write case reports. I also have written a case report on Peterson hernia, if you know, after is OMY gastrectomy. So case reports. Now students in their bachelor's, especially Chinese students in their MBBS, they usually have written a case reports and published in a paper in journals. So the world is moving very fast. So I wanted you guys to have a look what is a case report. So that's why I have shared here. I will at the end of the class, I will also share this, the PDF form of this case report to you. Other than that, you can also copy this link and copy and paste the link to read the case report. It's a good way of presenting a case, and I hope you can learn something from it. Okay, so today we'll start dental anatomy. So dental anatomy is basically the anatomy of the teeth, and nomenclature is how you basically number the teeth. So when you go to a dentist, they do the x-ray of I2 or whatever the nomenclature system they follow, they know. And if we don't know, if we don't have a nomenclature, then the patient is on the surgery, the x-ray, the radiology department has done an x-ray and said, okay, on the right side, and the patient, the surgeon has not seen the x-ray and he's starting on the left side, and then he cannot find the deformity. That's why we need a nomenclature of the teeth, because there are numerous. So dental anatomy, the learning objective of our class will be, after attending this lecture, the students should be able to identify the major structures of the dental anatomy, the anatomy of the teeth, including the external morphology and the internal composition, also known as microanatomy of individual teeth. Discuss the primary characteristic of enamel, dentin, cementum, and dental pulp. Describe the biological functions that take place within the oral cavity, including the environment of the oral cavity. Follow the international nomenclature and terminology used for the teeth, and describe the relationship of teeth to each other and to the jawbone. So this is our learning objective for this class, this slide. Let's start with the dental anatomy. Okay, so we have 52 participants. If anyone have any question related to the previous slide, now is the time. Otherwise, I will just start the next lecture. If anyone has any question, anatomy of the teeth. This guy is smiling. Why are you showing your teeth? Okay, let's see. Definition. There are two definitions. Primary teeth, also known as deciduous teeth, and then baby teeth, milk teeth are the layman terms, but these two terms are the medical terms. This baby is showing his or her baby teeth, which are also known as deciduous teeth. Okay. So there are two definitions. Primary teeth, Hassan Ali is not will not missing a lot of things. This is easy. Primary teeth, deciduous, and secondary teeth, permanent. So these are baby teeth, milk teeth, deciduous teeth, primary teeth, and these are the permanent ones. If you lose them, you still smile, you will grow back. If you lose them, no smile, will not come back. That's why, because they are permanent, and once they are gone, ta-ta. So elements, what are the elements of the tooth? A tooth is made up of 3 elements. Water, I can't see, everything is made of water. Okay. Organic materials and inorganic materials. Okay. Organic like carbon, biochemistry, and inorganic like some chloride, calcium, phosphate. Okay, we'll see about that later. So primary teeth, we go to the primary teeth. Right side, we have a lot of primary teeth, usually 10. How to remember? These are 10 or 20, deci, deca, 10, dual, 10 dual, because upper teeth are 10 and lower set of teeth are 10. So deciduous, 20 teeth. Consist of 20 teeth. Chat. Sir, I am present. My internet is fluctuating. Internet is fluctuating. Okay. I don't know how to respond that. We'll see later. So consist of 20 teeth. Okay. You try again. That guy, you try again. How do you just Junaid Fareed, please reply him to try again.
Okay, sir.
Okay. So Consists of 20 teeth, deciduous. That's why deciduous. Baby teeth, milk teeth begin to form during the first trimester of pregnancy. So the baby is in, still the woman is pregnant, and inside the first trimester, these teeth are begin to form. So when the baby is born, why these teeth are not shown? They are not outside. Why? Because they are inside, sir. Still inside. Give them some time. Okay. Sure. So typically begin erupting around 6 months. So at the age of 6 months, they start eruption. Why have you written 8 to 12 months? This baby is slow. No, actually, the thing is an estimation. Some babies start erupting the teeth, eruption of the teeth at 6 months, and it goes from the 8 to 12 months. Okay, and teeth coming. Oh, central incisors start from 6 months. Now we will not forget. So from the 6 month, central incisors come out. Oh, these little guys. Oh, that's why this baby was smiling. That's why this baby was smiling, because it has the central incisors, right? Oh, I see. Okay. So now we remember the first teeth which start eruption are the central incisors. Okay, perfect. And they start erupting from 6 months and goes as long as 33 months. What is 33 months? Almost 3 years. Okay. Typically begin erupting around 6 months and complete the primary dentition by the 3 years of age. Dentition is nothing but a set of teeth. So you can say primary teeth or primary dentition, or deciduous teeth, deciduous dentition, or permanent teeth or permanent dentition. Dentition is a more medical or professional word for the set of the teeth. Okay. That's how we remember. From 6 months, central incisors come, and at the age of 3 years, all of the set of the deciduous teeth have erupted. They start shedding at 6 years. At 6 years, up to 12 years, when they are shedding at the age of up to the 6 years, who are coming? The permanent teeth are coming. How many are they? 32. So permanent teeth are 32 in the most cases. We have 10 minutes remaining. Oh, this guy. Come on, don't do this. I think if I use mouse. Oh. Okay, I'm also learning with you guys. Thanks to you. Okay, so consist of 32 teeth in most cases. These are the permanent teeth and began to erupt around 6 years of age, when those teeth are almost started shedding. They tell we are going, you should start coming in. So they tell that start eruption. Secondary teeth, permanent teeth, please start eruption, because at age of 6 years we are going. Okay, and then most permanent teeth have been erupted by the age of 12. Double than this, easy to remember. Perfect. Third molar or wisdom teeth are the exception. Oh, medical science is exception. Come on. Okay. Third molars, wisdom teeth are the exception. Often do not appear until the late teen age, early 20s of your age. Okay, no problem. Thank you. That's why it's written here. So if we annotate this basically, so if we see all of them have started erupting from the 6 to 7, 8, 9, 10, 11, 12, 12, 13, up to 12, 12, like 12, 12, 12, 7, 8, 7, 8. Only one is an exception, going up to the late teens of 20s. Yeah, 21 years or 20s. So that's third molar. But other than that, all the permanent set of the teeth, the permanent dentition, the secondary dentition has completed almost to the age of 12 years. They are done. Who is remaining in 20? Wisdom. Okay. But it does not mean that you are not wise at 12. Okay. And you will be wise at 20. It does not mean. Whoever named this teeth thought that maybe. Third molar. Okay. Third molar. Okay. So this is also a comparison between the deciduous teeth and the permanent teeth. Upper teeth, lower teeth. We have incisors, central incisors at 7.6 months. Why it was 6? This was not 6 months. Oh, these are upper. Sir, these are upper. Lower were starting because the baby was smiling and his lower were almost in, upper were still coming. This guy is coming. That's why he's smiling. The lower start first at 6 months, followed by these, and then from the medial side to the lateral side, they come. So at the 20th month, second molar have came, and 1 2 3 4 5 5 half 5 5 10 and 5 5 10 20. Okay, you are okay. This baby is okay. And now this is a secondary teeth, permanent teeth. 32 upper dental arch, lower dental arch, and then these are the age. You do not need to remember all of them, but these markings, the age, 6 years start, 12 years end, 32 teeth, and last come at 20s, and then this 20 teeth, primary teeth at 6 months they start from the central incisors. At the age of 3 years they are done, and 6 years they will stay. At the age of 3 years, all of they have most children have completed the primary dentition, and they will use it for 3 years up to the 6 years when it starts shedding, and at the 6 years of age of 6, the others start erupting. Okay, easy to remember, makes sense. Sir, again extra pictures, why? So that you can remember. We have color coded here incisors and canines and first premolar, second premolar, molar. So are you trying to say that we have 4 types of teeth? Incisors, canine, premolar, and molar? Oh, so these teeth are color coded according to the teeth, so that you remember the central incisors come first, and here also they come first. So first molar is known as first also, not only because it's in the first position, but it also comes first. Yeah. So if I ask you what are the permanent dentition teeth which come first, so you will remember central incisors along with the first molar, not first premolar, first molar, because we still need to chew our food, right? You need to grind it, and molar grinds the food. So are you saying that molars help in grinding the food? Okay, we know one of the function now. So let's start with the identifying teeth. We have classification of teeth. Incisors, don't say incisors, incisors, canines, premolars, molars, and third molar, wisdom teeth. So incisors are central and lateral. So if it's in the center, central incisors, can you see these are the central incisors, and then on the later we have lateral incisors. Okay, and then we have canines, no central, no lateral. The premolar are first, towards the center is first, and away from the center is towards the molar is second, premolar. And then first molar, second molar, third molar is wisdom teeth. You don't come early, we know that. You come at the teenage 20s, right? We remember. See? Okay, very easy to remember. So incisors, canine, premolars, and molars. So there he is written cuspid and bicuspid. What do you mean by cusp? Cusp is this one cap, let's just say. Okay, so it has 2 caps. This is bicuspid, and it has 4. They are tetracuspids, molars. Okay, if someone's molars are broken, you cannot see 2 cusps. So if someone's molars are broken from one side, does not mean it's tricuspid. Okay, so we have cusp, cuspid, bicuspid, and tricuspid. We'll see later how. Okay, so premolar, 2 cusps, molar, 4, almost like that, right? And then we have canine, 1 cusp, and incisors have no cusp. They are flat. They are flat, and they bring food into the mouth and cut it. Canines tear it. Premolar and molar grind it. Okay, incisors function as cutting or shearing instrument tools for food. Incisors, they cut. Canines, they tear. Premolars, they tear and grind, and molars, they grind. Hassan, roll number 61, 061. Hassan Naki.
Yes, sir.
Okay, so do you know anything about permanent teeth and primary teeth? Anything, whatever you can repeat?
Yes, sir. Primary teeth are deciduous teeth, and the permanent teeth are after the deciduous teeth. So
Okay,
the first deciduous teeth that develops are the central incisors. It
wow.
usually takes them like 6 months to 10 months.
Oh, they start from the 6 month, right?
Yeah, yes, sir.
Oh, perfect. Okay, and then
So
the okay, perfect. It's enough. I think let's ask someone else about the permanent teeth. Okay.
okay, sir.
Okay. Thank you for your answer. Let's go to Atif Khan. Atif Khan 004.
Yes, sir.
Okay. Can you tell us something about permanent teeth quickly?
Yes, sir. Permanent teeth. Sorry. A permanent teeth come after deciduous teeth and remain. Its central incisor come at the age of 6 to 7 years,
Okay, 6 years.
and
6 years. Yes.
yes, sir. And
So how long these secondary teeth remain? For how long?
uh, sir, whole life.
Oh, okay, that's good. So it means if there's between 6 to 7 years, they just erupt at that time, right?
Yes,
Okay,
sir.
thank you for your answer. Thank you for your answer.